Yield back.
Now recognize Ms. Ross from North Carolina for 5 minutes of questions.
Thank you, Mr. Chairman. Dr. Morens, I really take very seriously these allegations of misconduct and the unauthorized disposition of NIH email records, your blatant disregard for transparency obligations under FOIA, and the manner in which you conducted yourself, including disparaging language toward others of differing perspectives, not only call into question your judgment, but also your character. And on a larger scale, they inflict serious damage on public trust for the entire scientific enterprise. Because you don't, when you work for the federal government, you're not just working for yourself. You're working for the people, and you're working with your colleagues. Since the start of the pandemic, we have seen a decline in the public's confidence in science and public health. One study conducted by the Pew Research Center found that between April 2020 and October 2023, the number of Americans who reported that they had a great deal of trust in scientists fell by 16%, from 39% to 23%. And while proliferation of misinformation about COVID-19 has certainly fueled this decline, when the American public sees that one of the federal government's own scientists was potentially trying to hide their work-related conversations from the public by using a personal email, that will only lead to further distrust in our nation's scientific community. And this decline in the confidence in the scientific enterprise has rippled and had health effects that we're seeing even now. For example, we've seen the effect of the distrust in science specifically within our vaccine records. A recent survey from the Annenberg Public Policy Center found that the proportion of respondents who did not believe in vaccines that are approved in the United States, it doubled from nearly doubled from 9% to 16% between April 2021 and the fall of 2023. And with new variants of the coronavirus, fewer and fewer people are getting their booster shots. As we hold today's hearings, the United States is at the precipice of losing our measles elimination status due to repeated outbreaks of the disease that have popped up across the country, from Florida to Ohio to Missouri to California. This is especially concerning as 250,000 kindergartners nationwide haven't received their updated measles immunization, leaving them unprotected from this deadly disease. That is not your fault. But what I am saying is, when people don't trust scientists, they don't trust the science. So you've answered this question in another way, but do you agree that your conduct as a scientist working for the federal government betrayed the highest ethical standards that are expected of you and are expected to maintain the trust of the American people?
Well, that's a several-part statement, and let me answer it by saying I've always thought of myself as an ethical person. It's important to me to tell the truth and do decent things, and that's why I stuck my head up to defend Peter when he was under death threats. Obviously, and I thought all these things I was doing that were on my private email, my private Gmail, were outside the domain of my official job as a private citizen. But I've obviously made mistakes. I've mixed up emails and Gmails, and that's caused me to do all of the things you mentioned, but bring discredit on myself and on the government. I don't know what to say. I've apologized. I regret that. I wish I could take it back, but I can't.
Thank you. It's imperative for the American public to trust the scientific community in order to best protect our nation's public health. We're seeing in real time the consequences when trust declines. As members of the Select Subcommittee, it's critically important that we work to rebuild that trust in public health and science. Your actions have not helped these efforts. Thank you, and I yield back.
I now recognize Dr. Miller Meeks from Iowa for 5 minutes of questions.
Well, thank you, Mr. Chairman, and I thank you, Dr. Morens, for testifying before the Select Subcommittee.